So now I already numbed it up. He's got both of the nails on this side, and that side is ingrown. So we're gonna start working on it. So it's pretty deep. How you feeling? No pain?
No pain.
Nothing? How about now? Nothing? So you get, this thing's pretty deep in there, huh? So we free this up. He's off this week, so I'm trying to do both feet today. Usually I don't like doing both feet, but since he's off today, it's a good time to get this done. A lot of times the shoes could be too tight, so in that case you have to wear a different type of shoes or not too tight of a shoes. A lot of people wear shoes that are too tight. Also, when you have this nail off, this area, the skin kind of moves up and it doesn't have the space for the nail to grow. So you have to make sure that when you're soaking, you spread this skin away from it so that that's the nail right there. And then there's a big piece of skin also that we need that as well. We want to make sure that this drains properly because it's going to be draining from here, so we need to remove all the skin around this so that it properly drains. And then I'm going to make sure that this is nicely all cleaned up, which it is. Chemicals, you can use chemicals afterward, but when it's infected like this, you don't want to use chemicals because that's going to cause more infection. So chemicals can be done after the infection is gone. I don't use chemical that often because chemicals are kind of, it's easy to do, but it makes the nail look really deformed afterward a lot of times. So it's not going to be a cosmetic procedure. So a lot of times it's very ugly after. So try not to do that procedure. I prefer cutting it out. And here's the nail right there. And then there's a little piece sitting over here, which we'll take out as well. Like I said, you can use chemical or you can cut it out like what I do. It makes chemical way of doing it, makes it look really ugly. So I try not to use that method. Some people use it because it's easier to use. And there's some skin underneath it that needs to come out so it drains nicely. It's almost done now, so I'll make sure that everything's out of that corner so it drains nicely and heals. So it looks really good now. There's a little piece that needs to come out as well. We have to make sure that that piece comes out so that it looks nice afterwards. This is to stop the bleeding, so it's pretty bloody and we want to make sure that I can see what I'm doing. A lot of times I can leave a little spicule of the nail in there, and if I don't see it properly, then I may leave it in there, which is a big problem. So that's why I use a tourniquet to stop the bleeding to that area. Now you're going to start bleeding right away, you see? So we're going to make sure that it doesn't bleed. It's antibiotic cream. And then bandaging.
How long you want me to leave that on?
Just until tomorrow morning, until you start soaking tomorrow morning. So I recommend patients to start soaking twice a day starting tomorrow morning. So antibiotic, and then after that you could put antibiotic cream and a Band-Aid. But if you happen to be home over the weekend, then you want to leave the Band-Aid open so that you get the air to it, because more air to it, quicker the area heals. Okay, or you want to, but if you're going out doing something, then you need to put the Band-Aid on, because you don't want to prevent any further problem or infection. Absolutely no pain usually. They don't feel any pain at all, because the pain is worse after about 30 minutes of the procedure. That's when they feel more pain. But I give them anesthesia that lasts 3 to 4 hours, so that bypasses that pain time. So most people don't have pain after. We're back in 1 week. Okay, that's it.